Hello and welcome. My name is Wanda Hancock. I'm Director of Student Affairs and Admissions here on the SRTC Thomasville campus. SRTC Thomasville is located at 15689 US Highway 19 North, Thomasville. SRTC Thomasville offers several programs in the areas of arts and sciences, business and computers, health sciences, industrial technology, and professional services. Welcome to the Student Affairs Department. Here in Student Affairs, we start at the very beginning, which is admissions, helping students to get started on their path, choosing a career field to go into, helping them get the paperwork that they need to be accepted. We also offer testing services for students that need to do placement testing for admission. We continue on through helping students financially go to school by offering financial aid services and staff that students can talk with. We also offer resources in the areas of disability services, if a student needs those services. We also offer a program called the Linden Library. For students who qualify, they can receive a book for their classes versus having to pay for the book and then turn it back in at the end of the semester. Tutoring services. We have some wonderful tutors here on the SRTC Thomasville campus who provide in-person tutoring. We also offer an online service for our online students who also need tutoring. We offer several lunch and learn seminars every semester here on the SRTC Thomasville campus. Some of those topics include stress management, test taking skills, test anxiety, financial planning, financial budgeting, just some areas that staff, faculty, and students might be interested in and want to attend those sessions here. We offer some dynamic programs here at SRTC Thomasville campus. Some of those to include veterinary technology, associative science and nursing, and land forest wildlife technology. Come on, let's go take a look.
I'm Jennifer Mason, and I am the Program Chair of Veterinary Technology. I began in this role in October of 2018, so almost 2 years now, and I've been in the industry for going on 14 years now, and I was in small animal private practice prior to my role here. Currently we have about 20 students enrolled in our program, and we employ 2 faculty in addition to myself. One is a full-time registered veterinary technician, and the other one is an adjunct at about 20 hours per week. Fall is a busy time for us. We have a lot going on in our department because both classes, the freshman and the senior class, are on campus during this time. We are teaching surgery and anesthesia, laboratory and exotic medicine, anatomy and physiology, just to name a few of the courses. Currently, our students are assisting in a lot of surgeries. That includes spays, neuters, and any other things that may come up like mass removals or amputations. And our freshman students are currently dissecting their cadaver dogs and learning intimately about the anatomy of small animals. In order for our students to complete all of their essential skills that are regulated by our accrediting body, we have to take a lot of field trips off campus in order to perform those skills on a variety of different animals, including ruminants, equines, and pigs. So we travel to different farms that have all of those animals, including goats, cows, and horses, in order for us to be able to gain those skills. In our department, we feel very lucky because we have a variety of areas for the students to accomplish their learning. We have a lecture hall that comfortably seats 25 or so students when we are not socially distanced. Right now, our largest class is 15 students, so we're able to be 6 feet apart, which is very nice because it's still large enough to accommodate that. And we also, in addition to our lecture hall, have a treatment facility which replicates a functioning animal hospital with wet tables, dental equipment, digital x-ray. And we also have a laboratory with around 20 microscopes in addition to a video microscope for teaching purposes. That's where our dissection is taking place and any of our clinical lab work or microscopy goes on. And then we have an x-ray room and this room that I'm in now, which is our surgery suite. It is housed to be able to accommodate 2 surgeries at one time, and we keep it pretty busy in here. Our accrediting body, the AVMA-CBTEA, recommends or requires that our students complete 240 hours of clinical internship. Our program dictates that our students accomplish 540 hours. So we really feel like the entire semester that these students spend in clinical work is very beneficial to them because they get real-world hands-on experience that we cannot always replicate here in the school setting. Most of our students choose to go into the private practice field in the local area, in our service area here. But there are a ton of opportunities for our students outside of our service area, which includes specialty practice and referral practices, government, industry. There are just so many opportunities for them. Currently, most of our students do go into private practice. We have had 2 who are employed by referral specialty hospitals, and we're quite proud of them. Last year, our department created an MOU with St. Matthew's University in Grand Cayman, where when our students graduate our program, they are eligible to start their veterinary degree down there at a reduced admission. So they really just have to satisfy an interview process and have successful completion of our program here, and they can go on immediately to obtain their DVM degree, which is an amazing opportunity for these students, and they can accomplish that degree in less time than a traditional DVM student. So as I mentioned before, I started here in October of 2018, and at that time the program did not have the best pass rate for the national board exams. We've been working really hard to increase that, especially because now our accrediting body has requirements as far as maintenance of accreditation. And just this past year, we graduated our seniors during COVID, and we have had all of them take their national board exams, and we have an 83% pass rate, which we are very proud of, and we expect that that will continue to increase as we continue to work on this program and make it as good as it can be.
My name's Elizabeth Delk. I'm a senior in the veterinary technology program. I started the program in fall of last year, 2019, and I expect to graduate next spring in 2021. All 3 of our instructors are really top of the line. They really pour their heart and soul into this program, and not just the program, but into us as students, and they really have become a really good support system. The equipment that we have here at the Vet Tech program is really like top of the line. We do anything from radiographic x-rays to dental x-rays, which I'd never been able to do before. And so it's really, our equipment has allowed us to learn a lot. My #1 plan after graduation is taking a long beach trip. And then after that, hopefully apply or get a request from a mixed animal hospital. So that would be large and small animals. That would be something that would be really cool for me to do.
Hi again. Welcome to Southern Regional Technical College Thomasville Library, your one-stop shop for all your academic needs. Here we offer computers for our students to use. We have study rooms where groups can get together to study for exams or just private individual studies. We have online resources. We have the Galileo system, which is the electronic book system for our students. We also can offer in between all of our libraries. If a student needs a book that's here, that's not on another library campus, we can certainly make sure that that's inter-delivery to that campus for that student to use. Come take a look.
Hi, I'm Tammy Bryant, Program Chair for the ASN program here at Southern Regional Technical College. I started at Southern Regional Technical College in 1993 in the Practical Nursing program as an instructor there. Since that time, I've moved from the Practical Nursing program, established a gerontology program that our college had, and now I'm the Program Chair over the ASN program. I've been in the nursing career for about 33 years now. Our ASN program here, it has, for our Thomasville campus, we average around 160 students. Our students on the Thomasville location this semester, they're learning about a couple different things as we have multiple cohorts that start in the fall. So our first cohort is a fundamental cohort, so they're learning the basic skills here in our virtual lab that start off with basic vital signs, bed making, those kind of skills. And we go as far as to have a senior cohort this semester as well, who also do their clinicals in our virtual hospital and at the settings at our local hospitals, and their preceptorship in their senior programs as well. Through our virtual hospital here, they can do up to 30% of their clinical time here working on our mannequins. Nursing is a wide variety of partnerships with multiple clinical facility sites. Our main site here for our Thomasville campus, of course, is Archbald Memorial Hospital. We also utilize the health departments here, some of the doctor's offices here. We've also been very blessed just recently to have a connection with PCOM, which is the Philadelphia College of Osteopathic Medicine, and they allow our students to do some interdisciplinary work with them. And the fact that they can go up and run some simulations with them, attend post-conferences or debriefings with them. And so it allows the students to see not only the nursing perspective, but also into the physician perspective as well. The ASN program at Thomasville has a 10-bed virtual hospital. The hospital was designed to look a lot like Archbald Memorial Hospital's North Tower. The reason for that is our students in this program are trained on the equipment and the specialty items that are used at Archbald, because they employ most of our students from our Thomasville campus. So we want to make sure that we train them so that they're program ready and they're work ready when they leave us. In our virtual hospital, we have 6 what we call MediMen or iStan or simulators. Our simulators cost us about $80,000 per simulator. They have heart sounds, lung sounds, bowel sounds. They will talk with you. They will let you start IVs on them and have a return. They'll have urine output. We can make him cry. We can make him seize. We have a birthing mannequin that will actually birth the mannequin for us. We have a pediatric mannequin that will go cyanosis on the students. We will watch to see if they notice that, and then it can actually go into full cardiac arrest. Both our babies and our adult mannequins. Our senior students do practice a full code in here on our mannequin before they're sent out into the workforce, so they've had that experience of running a full code. Besides our simulation mannequins, we have IV start arms so that they can learn how to start IVs not only by locating it virtually through a computer, but they actually put their hands on a IV arm and insert that. And then we have our basic skills models. Our basic skills models are what we use in our fundamental course so that they can insert their NG tubes, insert their catheters, and learn their basic skills. And then one of our best qualities of our lab is we have what's called learning space. Learning space allows us to video the students while they're in here doing their simulation. It also allows us to talk to them from the nurse's station. And then at the end of the day, we can play back their scenario with their group of students into the large classroom, and we can do a full debriefing. And we can compare what one class did to the other class. And it's a very outstanding learning experience for the students, so they can see what each group did, what one group might have done great and the other group needed to work on. So we're glad that we can offer that opportunity. We have 100% job placement in our ASN programs, and that's not uncommon across the state of Georgia, as we all know that we're still in a nursing shortage. Our students are working anywhere from emergency rooms to ICUs to school nurses. A lot of them will do some travel nursing after they get their first year of experience on a med-surg floor. We highly recommend that. But we see that their success stories takes them everywhere. And the most dynamic success story I have is that we have graduates of our LPN program, of our ASN program, that continue their education for their master's, and they come back and teach with us. So we have current staff members who started here in technical education, just in the LPN program, that has gone all the way through and are back home with us. So we're excited that they love the field so much and that they love technical education and will come back and teach with us as well. We see a lot of our students that are not only staying in the area, some of them are going to the Atlanta area, working in the major hospitals in the city area. So they're well trained, they're well equipped, and they're ready to take on the world.
Hey, my name is Josh Pollock. I am a nursing student in the Southern Regional Technical College nursing program. I started the program in January of 2020, and I'm expected to graduate in May of 2021. So I work in the medical field now. I work as a paramedic. I went through EMT school, and I have gone through the paramedic program here at Southern Regional as well. Work as an adjunct faculty member, and I was very interested in going to nursing school, trying to increase my options that I have, because as a paramedic you are able to do a lot of good, you're able to get a lot of things done, but you're limited on your options for career fields and where you can go from there. And so I came by and talked to some of the instructors here and was very impressed with the program, and so I decided to come right here, right at home, to Southern Regional Technical College to go through the program here for nursing. First off, we have a very good working relationship with the instructors here at the Technical College. Everyone from the program director, Ms. Bryant, all the way down to any of the adjunct instructors that we've had here. It's just been a great experience. Anytime that I've had something come up, I've been able to reach out to them. They're very timely about getting back with you. They're very understanding about what you got going on, and that in nursing school, you do have a lot going on. And so they are excellent about working with you through those things. We're very fortunate that at this program and at this college, we have a lot to work with. Up-to-date virtual classroom. We've got an experience that really takes you out of the school and into the hospital setting and really gets you prepared for what you're going to see when you get out there. SRTC has prepared me in this nursing program, and with the excellent instructors that we have here, to go out into the world and be able to put my hands on patients and be able to be confident in my skills and to be confident in what the needs are of that patient and the right way to go about meeting those needs. So since the coronavirus has come into play, there's been a drastic amount of changes in the healthcare field, going from walking up to everybody that you meet, having just the basic PPE on, to learning the things that we would use every now and then. We're using them every day. We're adapting to the policies. The policies are changing daily in the healthcare field and what the recommendations are from the CDC. And so there has been a world of change from the time I started nursing school in January of 2020 to now, and everybody's scrambling to try to figure out the best way to prepare students for that and to prepare one another in the healthcare field for that. And so as a program, that's something that they've been trying to do, and they've been excellent about working with us and adapting to the ever-changing world that we live in now. Well, my plans after I graduate, I've been fortunate to receive the Arts Bowl scholarship, and so I plan to stay here local. I plan to spend some time with Arts Bowl, at least 3 years, to pay back the scholarship, and then, for lack of a better term, I'll figure out what I want to do when I grow up. I work as a flight paramedic now, and I've considered going and doing some flight nursing, at least part-time, but I'll have to work a couple of years to get my experience built up for that, and then see where I go from there.
I'm Dr. Jeremy Green, instructor for Land Force Wildlife Management classes at the Thomasville campus. I've been employed with SRTC since May of 2019. The Land Force Wildlife program is a unique blend in the state of Georgia of wildlife and forestry curricula, so wildlife and forestry classes that are combined together to prepare students for careers, entry-level careers in land management in the Red Hills region and in the southeast United States. Well, approximately this semester we have 20 students enrolled at the Thomasville campus. We just graduated 7 at the end of summer 2019. So each semester we have 4 different classes that we teach. per semester, so it breaks into 3 semesters. This semester, the students are going through basic certifications they need for their careers, like hunter education, hunter safety certification, going through boating safety certifications, basic CPR and first aid. They're also learning how to age and sex important wildlife species in our area, like white-tailed deer, northern bobwhite quail, and wild turkey. They're learning how to take population parameter data and estimate population density of those wildlife species. They're learning how to safely operate and maintain equipment that's very important for land management, such as basic tractor skills, hooking up and using a rotary mower, a disc harrow for land management purposes, how to apply that, an emphasis on safety, proper use of personal protective equipment while they're doing that. Chainsaw operation as well. And lastly, one of the big things we're doing this semester is learning how to diagnose important and significant tree diseases in our region, such as fusiform rust and pine bark beetle infestations that occur, and how to properly treat and control for those. Well, our traditional classroom is what's surrounding me right here, where we have desks with laptops, and we also have important specimens that we use in class on a daily basis. Outside this room, we have a very large garage bay that houses all of our heavy equipment and larger equipment, like our tractors and chainsaws and our implements that we use for land management. And then the most important classroom we have is about 30 acres outside of this building that we're continuously managing on a year-round basis. It's our working outdoor classroom that the students are involved in week to week to week. They spend hundreds of hours doing whether it's prescribed burning, or whether we're planning a food plot, whether we're looking for tree diseases, whether we're taking population density, looking at population surveys for wildlife on our campus, felling trees, learning how to safely limb and buck a fallen tree, and how to remove hazards. All those things are done on campus. Okay, so field trip wise, we go on a regular number of field trips to supplement their outdoor hands-on experience they get on campus, and we take students to select plantations in the area, which also serve as employers and partners for internships as well, and that's where a lot of our graduates end up going, and we go and tour what landowners and land managers in the region are doing. We also travel to publicly available wildlife management areas and work with professionals in the field, like the Georgia Department of Natural Resources Wildlife Resources Division. We're going to be working with Dallas Ingram, who's the state quail biologist, in just a few weeks, learning how to do cubby call counts for bobwhite quail, and also how to do trapping and banding and releasing of birds out in the wild. And we're going to be working with Joe Burnham, who is a red-cockaded woodpecker specialist, a wildlife biologist with Georgia DNR, and we'll be working with professionals throughout the field. Day one on the job, core competencies that are most important is equipment operation. Safe operation of equipment, proper use of a tractor, a rotary mower, a disc harrow, things like that, how to use those for land management purposes. The second most important core competency we have is the ability to use a drip torch and properly conduct a prescribed burn. Fire ecology is a big part of our program. The forests in the southeast, and specifically in the Red Hills, rely on the regular introduction of prescribed fire under controlled conditions, planned for conditions. So our students are taught how to conduct a prescribed burn and follow a pre-written burn plan. And students also should be able to go and create a very simple and basic property map using handheld GPS devices from a satellite image to map out property boundaries, land cover, natural resource use, and land management. The majority of our students who graduate from the program have been and continue to be employed by privately owned quail hunting plantations in the area. There are now over 135 privately owned quail plantations in the Red Hills region surrounding Thomasville and the Tallahassee area. That encompasses more than 400,000 acres, so there is a continuous demand for folks who are trained, who have an educational background, and can do the applied skills that are necessary to conduct land management on a day-to-day, year-round basis. I absolutely love my job here. I come to work every single day. I get my students gathered up. We go over the background information that we need to go over, and we are either doing something in the classroom, hands-on, or we are outdoors. We are outside as much as possible. We're in the shop as much as possible. We are hands-on engaged as much as possible. And some of the feedback I've heard from students that I love is that time goes by very quickly. It doesn't seem like work to them, even though they're learning quite a bit as we go through day to day to day. Every day is something different. So it's a wonderful place to work, it's a wonderful place to be, and this is a fantastic region that has a lot of history and a lot of need for well-trained conservation folks and young professionals that are going into this field. So I'm happy to be a part of that.